Hello everybody, welcome to another video, part 3 of how to lower your insulin use in weeks, the fat connection. I was actually I really wanted this video to be a Facebook Live video because I always curious about making a live video. I just like the spontaneity of it, but also because of time. It's been a very hard and busy week and I didn't have time to prepare and pre-record a video, so I figured I'll do a video while I'm at work, just so you know where I'm at. I'm in North Carolina Corrections, so this, yes, is a prison. This is actually outside of the prison yard. No, I'm not a prisoner. I know I'm wearing orange, but I promise you I'm not trying to escape prison. I'm working here as a physician assistant, and so shout out to my actually diabetes inmates, because here on this facility I have a lot of diabetes inmates, and a lot of them, a good number of them, have been able to reverse their diabetes with nutrition alone. So that's a lesson. Even with prison food, okay, even with prison food, you can reverse your diabetes. These inmates have proven it. With just focusing on lifestyle changes and the limitations that come with prison food, they've been able to come off their insulin. I've seen insulin A1Cs drop from 11 to 5.6 in just months. So just a lesson to all you guys who are struggling with diabetes, it can be done. But anyway, I wanted this to be the third and final video where we connect studies on using the fat connection when it comes to insulin resistance to come off your insulin in just weeks. If you watch part 1 and 2, you should be convinced that it's possible, and not just possible, very doable to come off insulin or at least reduce it immensely just by doing one thing: reducing your fat intake. Okay, and up to now we've been discussing that, and I think pretty well. What you need to do is reduce your daily fat percentage to a minimum of 15, I should say a maximum of 15%. So the studies that I want to highlight today in closing part 3 of how to lower your insulin use in weeks, the fat connection, is that 2 studies. Okay, so Dr. Anderson performed a study, and I believe it was 1979. Okay, and a very simple study. 20 diabetic patients were put on a low-fat diet. That's a diet that consisted of anywhere from 15 to 13% fat, and the rest being carbohydrates and protein. They were also encouraged to eat till they were full to avoid weight loss. So they wanted to make sure that even if you lose no weight, can you do it? Can you reverse your diabetes and lower your insulin use just focusing on fat and not even losing weight? What's amazing is that 58% reduction happened. A 58% reduction of insulin use happened on a low-fat diet with these 20 diabetics. So all 20 experienced an average of at least 58% reduction of insulin use in comparison to conventional diets. So they actually compared a low-fat diet with a conventional diabetes diet, which is a diet that is low in carbohydrates, right? And the low-fat diet outperformed the conventional diabetes diet. That's not the amazing part. The amazing part is that it took just 16 days for 10 of those 20 to come off their insulin altogether. So after just 16 days, 10 out of the 20 were able to stop using insulin altogether. Next study is from my main man, Dr. James Bernard. Shout out to James Bernard. Never met you, but you're doing great things. He's been reversing diabetes for over a decade, well over a decade. He did a study in 1994 where he took 652 patients and put them into a residential program, diabetes patients. What happened was amazing. On a low-fat diet, and he went really pretty low, 10% fat. I've seen success in just 15% fat, but in just 10% fat, total fat, and the rest of the calories coming from protein and on mostly carbohydrates, he was able to experience amazing results with his patients. Okay, I'm talking about 71% were able to reduce their use of oral medications. All right. Now, when it comes to oral medications, of course, that's another thing, right? That I know a lot of you diabetics want to come off of. But when it came to insulin use, there was an amazing transformation as well. Those 650 patients, 38% of them were able to come off their insulin completely. I mean, that's a lot. 652 patients, and 38% of them were able to come off their insulin use completely. Of course, all of them were able to at least reduce it, but 38% were able to come off their insulin completely. And guess how long it took? 3 weeks. 3 weeks. So what I'm saying, that you can lower your insulin use in weeks, it can be done. The step number 1 is lower your fat intake. Fat intake should be reduced to at least, I should say again, no more than 15% fat when it comes to your total calorie intake. So now, I know I promised a lot of you guys, as you have been asking me for meal plans and recipes. It's coming, I promise. It's coming to an inbox near you. But along with the meal plans, what I want to do is also give you a video, a mini coaching session, I should call it, on overcoming bad habits when it comes to eating. Binge eating and bad habits are really what's sabotaging your success. So I put together a video that is going to coach you on how to overcome poor eating habits and food addictions. Okay, this is very important, because knowing and doing is two things. Knowing and doing is two things, right? I know what to do, but I'm not doing it, right? That's the case for most of us. So if you have diabetes, or you're just looking to lose weight, and feel great, then reach out to me, message me privately, or comment me in the comment section, and the meal plan will be yours with a free mini coaching session to help you connect what is really getting in your way when it comes to overcoming food addictions and bad eating habits. I want to help you out, because I'm on a mission to reverse diabetes, and this is Diabetes 180. Okay, I want you to experience it. Thanks for watching.